Complementary medicine has been used throughout the world for centuries and obviously developed outside the influence of conventional medicine. Several healing systems and beliefs have evolved over time in different cultures and parts of the world. Let us take a look at a few. The concept of qi, or vital energy, is the foundation of traditional Chinese medicine. When the qi is in balance, the individual is in a state of health, and an imbalance of qi results in disease. It aims to restore the body's balance between two forces called yin and yang. Traditional Chinese medicine is based on personal history and observation of the body. Techniques such as acupuncture, herbal medicine, massage, and qigong, which is a form of energy therapy, may be a part of the treatment. Traditional Chinese medicine is very complex and research into its effectiveness is limited. Exercise care, as some herbal medicines may be toxic. Ayurveda is one of the world's oldest medical systems. It started in India more than 3,000 years ago and is still widely used in that country today. The name derives from the Sanskrit words meaning the science of life. It takes a natural and holistic approach to physical and mental health. Practitioners aim to bring three vital forces into balance to reduce symptoms. There seems to be some similarities with these ancient practices and what we are learning today. Those who use it rely on herbs, special diets, and unique practices to treat illnesses. But Ayurvedic products can also be dangerous. Researchers have found toxic minerals or metals like lead in some of the products. Research into Ayurvedic medicine practices have been limited, but we have seen some positive results. Other Ayurvedic therapies include yoga, meditation, massage, steam baths, changes in sleep patterns, and controlled breathing. Homeopathy, or homeopathic medicine, is a Western system of medicine based on the principle that like cures like. In other words, a large dose of the same substance produces the symptoms of an illness and can be fatal. Homeopathy was developed in Germany in the 1700s and follows the law of minimum dose, which asserts that the lower the dose, the greater the effectiveness. Homeopathic remedies are derived from a wide range of natural, sometimes toxic substances such as arsenic. Certain foundational concepts in homeopathy are at odds with scientific principles, and there is little evidence to support homeopathic therapies. Naturopathic medicine emphasizes the power of nature to restore health. Naturopathic physicians view their role as supporting the body's innate ability to maintain and restore health, typically by removing obstacles to these innate processes. Aspects of care may include dietary changes, stress reduction, dietary supplements, homeopathy, spinal and soft tissue manipulation, detoxification using fasting, juice diets, and colon cleansing. Research suggests that naturopathy may be more effective than conventional medicine for chronic pain. However, some practices are not supported by scientific evidence. Practitioners are not medical doctors. In most states, naturopathic physicians have completed a 4-year graduate program. Practitioners who are not physicians may have received less training and are typically unlicensed. Be a good medical consumer and investigate the safety and efficacy of CAM approaches before you engage. Psychological and physical approaches, such as meditation and yoga, for example, are generally considered to be safe in healthy people when practiced appropriately. Nutritional approaches, such as herbal medicines or botanicals, are often sold as dietary supplements and are readily available to consumers. However, there is a lot we don't know about the safety of many of these products, in part because a manufacturer does not have to prove the safety and effectiveness of a dietary supplement before it is available to the public. Two of the main safety concerns for dietary supplements are, first, the possibilities of drug interactions. For example, research has shown that St. John's wort interacts with drugs such as antidepressants in ways that can interfere with their intended effects, and the possibilities of product contamination. Supplements have been found to contain hidden prescription drugs or other compounds, particularly in dietary supplements marketed for weight loss, sexual health, including erectile dysfunction, and athletic performance or bodybuilding. The NIH, National Center for Complementary and Integrative Health, is a great place to start your research when looking into therapies. You can find information on complementary therapies, information on natural products, safety information, and information on how to find a provider.